Thanks for watching Afternoon Live. All right, if you're in the dating world, you gotta listen to this. Here is the needs to know before you swipe right. Yes, we welcome the author of Sex, Lies, and STDs, Dr. Rob Huizenga joins me. Did I say that right?
You got it.
Oh, nice. I know we talked about that just like 2 minutes ago, and me and last names. Great to see you. Thank you so much for coming
Thanks
up
for
and
having
joining
me.
us. Your book has so many, reveals so much that I think a lot of people maybe might take as common sense, but it's not.
It's scary because people don't even think we have a problem, and we do. We got 25 million Americans are going to get an STD this year, and right now 147 million Americans are sitting at home with an active STD, don't even know it.
Are you serious?
It's a massive problem.
147 million.
Mainly that's HPV and herpes, but still, there are other STDs like chlamydia, gonorrhea, and syphilis that are rocket shipping up in the air. The STD came out with figures: 30% more chlamydia, 70% more gonorrhea, and syphilis has doubled in the last 4 years. It's shocking.
Why is that?
Well, there's three main reasons. Number one, our federal system, the public health, is in disarray because we haven't funded it. Okay. They're supposed to give Americans education and track positive contacts. Not happening. Number two, doctors are doing a horrible job. They're not sitting down and taking the time to take sex histories because they're too embarrassed, I think, and so nobody's getting testing. But I think Americans, we bear most of the responsibility because we're totally uneducated and completely unaware.
So what are we doing wrong? What are we not educated about?
Well, can I give you a couple of questions just to show where we're at? Are you ready for some high pressure?
I'm married with 4 kids, all accidental, you know, but I'm going to fail this for sure. Sure, let's try this.
For instance, what's the #1 presenting symptom of a sexually transmitted disease? What's the #1 thing that you'd look for? What's the #1 way they present, sexually transmitted disease present? The #1 way.
Oh, no. Itching or redness?
No symptoms. The #1 way STDs present is asymptomatically, and people don't know that.
Wow.
They're waiting for pain on urination or a discharge. It often doesn't happen, and that's the first thing. Okay, ready for number two?
Number two.
Okay. Number two is if everyone in the country used condoms, I just said 25 million new STDs every year, what percent could we lower that huge number of active STDs if everyone wore condoms every time?
Well, see, so here's how uneducated I am. I would think everyone.
Okay, and most people feel that.
Yeah.
But unfortunately, it's only by 60%. And the reason is many STDs are transmitted skin to skin, and you wear a condom and that helps, but there's a lot of skin to skin contact that's not protected, especially HPV, herpes, syphilis, and then even in STDs that are completely prevented, if it's used properly, it's only used properly about 80% of the time. So you have a huge fall through.
Yeah, that's a lot. 60% is not much, though. I feel like that would be much higher. Ooh, okay, third question.
All right, you're 0 for 2. The pressure's really on now.
I gotta get one right. We're going until I get one right.
Okay. What is the most dangerous disease in terms of deaths of Americans this year? Is it HIV?
No.
Is it human papillomavirus, HPV, or is it HSV, herpes simplex virus? Which one will kill more Americans this year?
I'm going to go with, I don't know what barely any of these even are really, but B?
HPV.
Yes.
You got it. You're going to the head of the class.
Thank goodness, this could be a very long segment.
Well, most people, understandably, because of where you're a lot younger than I am, but when we started out, HIV was killing literally thousands and thousands of people daily. Now, HPV, human papillomavirus, in terms of cervical cancer, 6,000 to 7,000 deaths. In terms of oral, rectal, penile, vaginal cancer, another 7,000 deaths. So that is going to kill twice as many people as HIV this year. And people don't know that.
I know you work with the celebrities. How much has people like Charlie Sheen, for instance, brought some recognition to this issue?
Well, Charlie Sheen did an amazing thing. When he went public with his announcement that he had HIV, he raised more awareness in that one morning announcement than tenfold more than the biggest impact on HIV understanding with World AIDS Day. Yeah. So it's a huge, huge event.
Well, because how many men, horribly, I think, but look up to him, in the life that maybe he lived and the women that he got. But what the your book is What Do You Need to Know Before You Swipe Right? What is one major thing that everyone needs to know?
Everybody needs to know that the majority of people aren't going to have a symptom, and you have to go to your doctor on a regular basis if you're at risk, which is most of us, to get tested for asymptomatic disease. And you can't depend on condoms. There are other ways to prevent STDs, including vaccines for HPV and herpes and various things like hepatitis.
So if you're pretty sexually active out there dating, how often should you go to the doctor and get checked out?
Well, people that are gay, people that have multiple relationships with a higher risk, probably 2 times a year, and people that are in the singles world at least once a year.
And is there any, like, just clinics you can walk into, take a simple test, or do you need to talk to your doctor, maybe find out
Well,
some of their
people need to
options for
find a
yourself?
doctor that they're comfortable with, and the doctor who's comfortable with STDs, or they do need to go into some sort of, family planning clinic. But the resources, or go online. The resources are out there, but you have to educate yourself about what to look for and how often to get tested and other non-condom ways to prevent STDs. And that's why I'm hoping my book will be of benefit.
And take your health into your own hands, right? Sometimes your doctors just don't want to have those conversations, so you have to let them know.
The doctors are in left field. We really didn't get taught this in med school, and we're as embarrassed and we're as stigmatized by STDs as patients are, unfortunately.
So yes, talk to them about it. Thank you so much.
Appreciate you having me.
Yes, absolutely. His book again is Sex, Lies, and STDs, and we'll have information about it on our website at KATU.com. Don't go away. Afternoon Live, we'll be right back. Stay right here.